Okay, let's unpack this. Have you ever wondered about the real differences between being your own boss and working for someone else? Especially later in life. So many people working longer, maybe starting something new. It feels like this question is, well, more relevant than ever. Today, we're doing a deep dive into some really fascinating research on this. We've got a study here, Sewdas and colleagues from 2018. It's a prospective cohort study from the Netherlands. And our mission really is to pull out the key insights. How does self-employment stack up against traditional jobs for older workers, thinking about things like self-rated health and workability? Does one path genuinely lead to better well-being, and what's driving that?
Yeah, and what's fascinating, just to set the scene, is the bigger picture. In a lot of European countries, like the Netherlands where the study happened, self-employment isn't niche. We're talking maybe 16% across Europe, 17% in the Netherlands. But look at older workers, say 50 to 64. That number jumps dramatically, up to 39%. Compare that to like 3% for the 15 to 24-year-olds.
Wow, 39%. That's huge. So it's not a small group at all. It's a major part of the older workforce. And it's growing, you said.
Expected to, yeah, especially with retirement ages going up.
So why? Why are older workers leaning into self-employment so much? Does the article give any clues?
Well, it suggests a few things. A big one is probably the desire for independence, control. But it could also be maybe it's harder to get standard job contracts when you're older, or perhaps they just have the skills, the capital, makes going it alone seem more feasible.
Right, that makes sense.
But that leads to the big question, how does this choice affect their well-being? Because it's a double-edged sword, isn't it?
How so?
On one hand, self-employed folks often say they have more autonomy, more flexibility with hours, with pace, and we know from other research that often links to higher job satisfaction. But the flip side is they carry all the risk, right? Business survival rests on them. That can mean longer hours. And some studies have pointed to longer hours maybe causing health problems or even more stress, mental health issues for the self-employed. And since health problems generally increase with age, well, understanding this balance is pretty crucial.
Definitely a complex picture.
Yeah.
So given all that, how did these researchers, Sewdas and the team, actually tackle this? What were they specifically trying to find out?
They basically had three main goals. First, just get a snapshot. What are the baseline differences in self-rated health and workability between older self-employed people and employees? Just how do they compare at the start?
Okay, the starting point.
Second, and this is key, does being self-employed actually cause or lead to better outcomes over time? They looked over a 3-year period. And third, do other factors matter? Things like education, money situation, having a chronic illness, or even job characteristics, mental load, physical load, that autonomy piece. Again, do these things change the relationship?
Got it. And you mentioned workability. Can we just quickly clarify what they mean by that? It sounds important.
Yeah, good point. They define it as how workers see their own capacity to do their job, considering their personal resources, health, skills, and what the job demands. And both that, workability and self-rated health, are really vital signs. They're known predictors of things like sick leave or even leaving work altogether.
Okay, vital signs. Makes sense. So they had their questions, their definitions. How did they go about collecting the data? What was the setup?
They used a prospective cohort design. Basically, they followed a large group of Dutch workers aged 45 to 64 from 2010 through 2013.
Following them over time.
Exactly. And it was a big group, over 1,000 self-employed and more than 12,000 employees. So quite robust.
Definitely a solid sample size. And what did that initial snapshot, the 2010 baseline, show? Were there big differences right off the bat?
There were some differences, yeah. At the start, the self-employed group, well, it had more men, and they were more likely to have higher education levels. Interestingly, they also reported higher autonomy, like we suspected, but also higher mental workload compared to the employees.
Higher mental load, huh?
Okay, and even at that baseline point, they did report slightly better workability, an average score of 8.3 out of 10 versus 8.2 for employees. And slightly better self-rated health, too, 3.4 out of 5 compared to 3.3.
So a little bit better on both counts from the start.
A small edge, yeah.
Okay, now this is where I think it gets really interesting. What happened over those 3 years? Did that small edge grow? Did one group pull ahead?
Well, here's the main finding regarding change over time. For workability, yes. The workability of the self-employed workers actually improved relative to the employees over those 3 years.
Improved, okay.
And that was statistically significant, meaning unlikely to be just chance.
Right, but what about health? Did that improve too?
No. For self-rated health, there wasn't a statistically significant difference in how it changed over time between the two groups. So that initial small difference in health, it just it stayed there. It didn't get better or worse specifically because of being self-employed versus employed over that period.
Huh. That's quite specific, isn't it? Workability improves, but self-rated health doesn't show the same pattern over time. It makes you wonder, what about all those other factors they measured? Education, finances, chronic conditions, the job demands, autonomy. Did any of those explain why workability improved only for the self-employed?
That's exactly what they looked at next, and this is another really key finding, maybe a bit surprising. They found no statistically significant interactions, basically none of those factors, not education level, not financial stress, not having a chronic disease, not even the mental or physical load or autonomy levels. None of them changed the basic relationship they found.
Wait, so the improvement in workability for the self-employed happened regardless of whether someone had, say, a chronic illness or lower education?
That's what the data suggests. The positive association for workability held across those different subgroups. It wasn't stronger for healthier people or weaker for those with financial issues, for example.
Wow. Okay, so if those factors didn't explain the difference over time, what did? Why did workability improve for the self-employed?
They dug into this, and the answer seems to come back to one thing quite strongly: autonomy. They found that the much higher levels of autonomy reported by the self-employed seemed to largely explain that positive effect on workability.
Autonomy again, how much did it explain?
A lot, actually. They did a post hoc analysis, and when they statistically adjusted for autonomy, the positive relationship between being self-employed and improved workability weakened by about 68%.
68%.
Yeah.
That's huge. So that feeling of control, making your own decisions, setting your own pace, that seems to be the main ingredient for boosting workability over time.
It strongly points in that direction, yes. It seems to be a really powerful factor. But there's another important thing to keep in mind here, kind of a methodological point, called the healthy worker effect.
Healthy worker effect.
Now,
How's that?
well, the researchers themselves note that the people in their study, workers aged 45 and older who are still working, are likely healthier on average than the general population of that age group. Think about it, participating in paid work, especially as you get older, often requires you to be reasonably healthy. People in poor health often have to leave work earlier.
Right, so the less healthy might have already dropped out of the workforce before the study even started.
Exactly. And that might explain why things like chronic disease or maybe even financial situation didn't seem to modify the results in this study. It's possible that only the relatively healthy people with those conditions were still working and included in the sample. So it could mask potential differences that might exist in the broader population. We need to be a bit cautious about generalizing.
That's a really important caveat. So, okay, self-employment seems linked to improving workability over time, likely driven by autonomy, but we're looking at a potentially healthier than average group to begin with. Now let's talk scale. We said workability improved. Was it a big improvement, like life-changingly better?
This is where we need to add some nuance. While the finding was statistically significant, meaning it's real, the actual size of the difference in workability scores was, well, pretty small.
How small?
Over the 3 years, the average workability was about 8.3 for the self-employed versus 8.1 for employees. The study itself calls it a small difference.
Okay, 8.3 versus 8.1.
Oh.
So statistically real, but maybe not a massive practical difference in day-to-day feeling.
Possibly. It suggests that while being self-employed has this positive nudge on workability over time, the absolute effect isn't enormous. It's modest. And if you think about the big picture, the aging workforce, keeping people healthy and engaged, this study hints that self-employment might help a bit with sustainable employment. It could potentially help people stay in work longer by boosting workability slightly.
A potential facilitator? Maybe, but not a silver bullet.
Precisely. Because the difference is small, you probably need more research to say definitively how big a role self-employment plays compared to other factors or interventions.
Okay, so let's try and wrap this up. Recapping our deep dive into this Sewdas study, we saw that older self-employed workers started out with slightly better self-rated health and workability. And crucially, over 3 years, their workability showed a small but statistically significant improvement compared to employees, which wasn't seen in their self-rated health. And the researchers strongly suspect this improvement is largely down to that greater sense of autonomy, the control that comes with being your own boss.
Exactly. But, and it's a key but, we have to remember that improvement was numerically small. So yes, self-employment offers some advantages, but the overall picture for older workers' health and workability is complex. It's not like one path is dramatically better across the board. And we also have that healthy worker effect to consider. The findings might reflect a working population that's already relatively healthy.
Which leads to a really interesting question for you, our listener. If these differences over time are actually quite small and seem driven mainly by autonomy, does that suggest that maybe efforts to keep older workers healthy and productive should focus on boosting autonomy and control for everyone, whether they're self-employed or work for a company? And if so, how would you even do that? How might you tailor ways to increase autonomy differently for employees versus the self-employed? What stands out to you from all this? Something to think about. That's it for this deep dive. Until next time, keep digging for those insights.